I have this visual image, metaphor, if you will, that, and I used this when my son was born, and I was trying to explain to people how day to day how I was doing. You know, 'cause people always say, you know, how are you doing, right? And what they really don't want to hear is a 10-minute summary of really how you're doing, you know. But the image that I created was, you know how when you have a glass of water, and I'm pulling out my glass right here, and you fill it all the way to the top, but you can go a little bit above it because the surface tension of the water creates what's called a meniscus. So it rises ever so slightly above the lip of the glass. And I would say
Like the
that,
magic of physics.
yeah, exactly, right? And I would say this is my life right now, and if I have one drop more of stress, it's going to overflow.
Yeah.
And that's how I describe, reacting to trauma. How my original reactions to trauma. I think I'm much more Zen-like now than I was 25 years ago.
Well,
But
might we actually go back, because our listeners probably don't know your story about your son John, and about 25 years ago when just that one extra drop would have just put you over the edge. Can we talk about your personal journey with your son?
sure. And I want to say that my son has given me permission to talk. You know, he's an adult, and we do have to respect his wishes and his privacy. But he's graciously allowed me to talk about his situation, so I'm grateful because I think it can be very helpful to a lot of people to appreciate his daily struggles and then those of his family, myself.
Yeah.
So
Where do you want to start?
well, um, let me just wing it. So, John is my third child, right? My first two children born, no problems. I'm not saying that I didn't have problems with them as they grew up, but yeah, uneventful births, okay, right? And 9 weeks before John was due, my wife and I sensed that something was amiss, and she couldn't feel the baby kicking. And that was like on a Saturday before he was born, on a Saturday, and so we didn't think much about it. And the doctor just said, anytime you want to come in, you could put a fetal heart monitor on and just make sure that everything's okay. And that was working. And on the day that we were about to buy our house, we were going to go to the hospital and just have the monitor put on, but lo and behold, there was a problem. And so he was born 2 months early, and we didn't even know if he had a fully developed cortex. But he does. And he's a brilliant kid. He's a brilliant man, I should say. And he's in law school right now. He's very smart, so there was no concern about that. But he
you
was
didn't know that then.
No, and actually, there was a risk of oxygen deprivation in utero that we wouldn't know until a child develops a little bit further if it causes any type of cognitive issues, right? But he was born 2 months premature, and he was born with a litany of symptoms, and it wasn't just premature; he had other issues as well. And he was in the neonatal intensive care for 100 days. It was very traumatic, having to scrub up every time we wanted to visit him. And to make matters, to kind of take the story and make it a little bit shorter, is that he got diagnosed with an extremely rare version of Ehlers-Danlos syndrome. Now, Ehlers-Danlos has been in the popular media for the last few years with artists and musicians saying they have EDS, but what they have is a form called hypermobility, which is loose joints and dislocations and fatigue. John's version is called dermatosparaxis, and it's all EDS are a form of collagen disorder, but John's particular type, there's only 15 people in the world that has his type. Or actually, it's probably more accurate to say there's only 15 diagnosed cases. And we've actually learned that the genetic mutation that causes it is called autosomal recessive, which means my wife and I both had the mutation, and we both had to pass it down at the same time. So my other two children are being tested as being a carrier, but they don't have the syndrome. It actually traces back to being Ashkenazi Jew in Eastern Europe. They were able to locate that, which is pretty fascinating. And so he has this condition that creates extremely fragile skin. So mere friction can tear open his skin. His skin is very loose. You know, think about a Shar-Pei. You know how you can lift the skin on a Shar-Pei and it just seems to like expand. Well, John, you can't do that with John, but his skin tension is similar to that, in that it's very loose, and that creates a lot of other problems, circulatory problems, because you need skin tension to help with your lymphatic system, with your blood system, your circulatory system. It affects the connections with ligaments and tendons, and
I think of a number of elder people who have perhaps something. It certainly wouldn't be EDS, but this quality of very fragile skin.
The skin deteriorates with age, and I used to say to practitioners, treat John like he's a very elderly patient with paper-thin skin. Turns out that was bad advice, and because John's skin is different than an elder's skin, and so he has had many serious injuries.
Well, hang on. In what ways? That might be a curiosity for many of our listeners.